Essential tremor is the second most common neurological diagnosis, and it affects about 2 million people in the United States, so it's a super common problem. And of course, there's a wide range in how severely people are affected, but a large number of people are severely affected. Focused ultrasound is a new way of treating neurological disorders using ultrasound waves. We fit a person's head with a frame and then with a cap that has about 1,000 ultrasound transducers, and each one makes ultrasound waves. And where those waves meet, it can make a small lesion in the brain about the size of a pea. And if we position that lesion in just the right place, it can treat symptoms like tremor in patients with essential tremor or tremor-predominant Parkinson's disease. A typical result for a focused ultrasound procedure for essential tremor is about 80 to 90% tremor control. And so that's often enough tremor reduction that a person can go back to regular activities, which may include eating, drinking, writing, putting on makeup, or whatever hobby or work activity they weren't able to do. There's often still a little bit of tremor left over, about 10 to 20% left over, and the hand may be just a little bit clumsy like it was before the procedure. So in that sense, it's not a cure. On the other hand, the results are usually sufficient that a person has enough improvement in their quality of life that they're very glad they did it. The evaluation for essential tremor is very straightforward. The first step is getting a referral to me to get evaluated, and that can come from your primary doctor, from your treating neurologist, or just from yourself. And then I evaluate you. Part of the process is getting a CT scan of the head, and that measures the density of the skull to make sure that it's compatible with the ultrasound system. And we also get an MRI to allow for targeting of the thalamus in the brain where we're going to be treating the tremor. On the day of the procedure, the first step is actually shaving your hair. We do need to shave it because it allows the ultrasound waves to get through the scalp and the skull to get to the brain. And then we fix a frame to the head and then put a dome that has all the ultrasound transducers on it attached to the frame. And then you go into the MRI scanner because the MRI, of course, is going to monitor the heat in the brain while the ultrasound waves are being used to make a lesion in the brain. So then we do a test lesion and we test how it affects the tremor and make sure there aren't side effects. And then we do a permanent lesion where we use a higher dose of ultrasound to permanently control the tremor. The procedure takes about 2 to 3 hours, and the recovery is usually about 2 to 3 weeks, where people need to be careful with their walking. Often people are off balance for about 2 to 3 weeks afterwards. For the last 15 years at UT Health San Antonio, we've been building a robust multidisciplinary team to treat movement disorders, and we've seen tremendous growth over that time. And for us, it's culminating in the opening of the multi-specialty and research hospital, where we're able to bring in cutting-edge technology to offer a new type of treatment for the first time in Bexar County in San Antonio.